Welcome. My name is Natalia. I am your food and health coach, and I am excited to talk to you about your blood work because most of you are likely getting a yearly checkup and wanting to make sure that your numbers are within range. And I really want you to know what are some of the numbers that are interconnected with each other and what you can do to bring those numbers within range. So, as your food and health coach, as you know, there are quite a bit of foods that can help to lower specific markers in your blood. So let's talk about maybe you've been diagnosed with prediabetes or high blood glucose, such as in this example, though this is high blood glucose, and this number here, the A1C, this is already in the diabetes classification because it's above 6.5. However, if you've been to the doctor and recently been diagnosed with prediabetes, that is when your A1C, which is pretty much the average of your blood sugar control over 3 months, versus the glucose that is just 1 point in measurement, one time measurement of your blood sugar. So let's say you've been to the doctor, these are some concerns, and you are looking at other markers such as your cholesterol levels and your triglycerides, and you wonder, like, are these connected? Do I need to follow a specific eating plan for my blood sugar and another specific plan for my cholesterol levels? And well, that can be a little too much. I'm here to tell you from doing this over several years that the strategies that are very efficient and successful at helping people lose weight and also reduce their cholesterol levels and blood sugar are very simple, and it can just be three things that we focus on to really see some changes in your blood work. So let's talk about where your risk for cardiovascular disease, if diabetes is a concern, but maybe if your cholesterol levels are also out of range, let's talk about inflammation because that could be one of the main drivers and you may not be aware. So let's talk about some of the imbalance such as inflammation that can drive several conditions. So in this picture, you can see how inflammation can be the driver for heart disease or depression or arthritis or cancer. So how is this possible? Well, we all have a different genetic, a different makeup. And I want you to think about your body as a chain, and we all have a weak link in that chain. So for some individuals, that weak link may be their cardiovascular disease, and that's why they are at higher risk for heart disease. Whereas for other individuals, that weak link could be more at the level of their immune system, and that's why arthritis develops or not. Or maybe toxicity is an issue for that individual and it's the weak link on that change, and that's why maybe they are more likely to develop cancer over time. Or there's many conditions, like I said, that are just kind of depend on your on unique individuality. So it's important to consider and maybe look at your medical history and maybe your parents' history and see what makes sense.